Hi, good afternoon, APTO friends, and welcome to the APTO Professional Series. My name is Tara Pastor Camarada, and I will be your facilitator today. So excited to have you all. This is going to be very engaging. We have an all-star team for you, an all-star lineup for the APTO Professional Series. We're talking about data systems supporting program standards. Okay, moving on. We start off with a quote, and we want you to work smart as we manage through this and know that the deadline is approaching very quickly. The deadline is November 15th. We want to work smart to meet and exceed program standards. The goal is not to be better than the other man, but your previous self, from the Dalai Lama. I just thought that was a great opening thought to get you centered into this course today, to get you centered into this program today. Think about that goal. Think about working smart. And we are here to help you and support you to meet and exceed the program standards. Next. Okay, quick poll. And you can put this in chat. We're going to have you start with your chat box. What do you want? Do you want a toolbox or a treasure chest? So if you would, put in chat what you want, a toolbox or treasure chest. Okay, Kim wants a toolbox. Cindy wants a treasure chest. Kathy wants a toolbox. Okay, we got toolbox. Hey, Alex wants both. Good for you. Casey, Rebecca, treasure chest. Both for Mary. Oh, treasure chest. Awesome. And fantastic. Thank you all for doing that quick one. And we're going to have more polls that we do in chat. And then we're going to have other polls throughout this. So this is interactive. All right, so it looks like we have a tie going on here. Go to the next slide, Amy. All right, learning is a treasure. Now think about this, that will follow its owner everywhere. And I love this Chinese proverb. Learning is a treasure that will follow its owner everywhere. So yes, you're going to get treasures for your personal treasure chest. Next slide. We're going to also give you tools. Now, who's out there? That's who we want to find out. This should be all regulatory because this was a private invitation event. So are you local regulatory, state regulatory, federal regulatory, or top secret? So put in the chat who you are. State, local, state, local. Awesome. We have exactly who we want here. Wonderful. Well, thank you so much for sharing if you're state or local. We don't have anybody that's top secret and we don't have anybody for federal. So again, this is a private invitation event and we're very excited that you're here. Next slide. Okay, now, where do you call home? Put in chat. Are you in the Northeast, Southeast, Southwest, Midwest, West, US territories, or international? Oh, we got Northeast, Midwest. We have Midwest, Northeast, West, Midwest, Northeast, Southeast, Southwest. Yay, we have the country represented. This is fantastic. Awesome. Thank you. Thank you, Adam. Depends what system. There you go. Awesome. All right, thank you all for sharing where home is. Next slide. Now, let's talk about our objectives for today. Our objectives are simple. We're going to give you tools for your toolbox to make your life easier and simpler. We're going to increase knowledge by these wonderful professionals that are actually in the know. So it's very targeted, very precise. We're going to decrease your stress and frustration. So any questions that you have, put them in chat and we're going to handle and get rid of that stress. We're going to get rid of that frustration. We're going to make sure that you get your questions answered with real world solutions. And that's our goal. We're also going to experience today and understand benchmarking and where your program ranks with your colleagues. So this is something that's really important. And the other thing are two more things. And these are the treasures and these are the tools. You're going to recognize best practices and put that in your toolbox. but then you're going to appreciate the lessons learned and put that in your treasure box. So treasure chest. So here we go with what our goals and objectives are. Next, please. And our professionals in the know. It is my great privilege and honor to introduce to you Jason Regan, Director of Environmental Health, Gwinnett, Newton, and Rockdale County Health Departments. We have Mark Speltz, Food and Consumer Safety Bureau Chief, Iowa Department of Inspections and Appeals. Paul Smith, President of Inspect to Go. He's also an inventor, engineer, and entrepreneur. And Chirag Bhatt, Director of Regulatory Affairs, Health Space Data Systems. So this all-star team is absolutely positively going to help you give the answers that you're looking for. And we're going to start off with Jason. Next slide. And as we start off with Jason, I really love this picture because a picture is worth 1,000 words. And this is Jason and his team. So if you would, please give Jason a big round of applause. All right, Jason, take it away.
Thank you, Tara. I do appreciate that. Yeah, this picture is actually at one of our Board of Health meetings where we met all 9 program standards. So that's all of our certificates. And that's kind of a momentous occasion for us. And so we were celebrating that. And we have 3 counties in our district. We did that at each of our counties. And so it was definitely a day to remember. So as I was introduced, I am the Director of Environmental Health for Gwinnett, Newton, and Rockdale counties here in Georgia. We're right outside of Metro Atlanta, and go Braves. And so I started out as an environmental health specialist back in 2008, come on board. And then in 2010, I got into the quality assurance side of things, and then eventually into the role of director. And so today, really, I was asked to kind of talk about our involvement in using data systems to support the program standards, the process we went through. So I just want to really briefly talk about a little bit about our journey and kind of how we got involved in the standards, and then how we had to involve the different data systems that we use to be able to meet the program standards. So I was really introduced to the standards back in 2010. We had signed up for them back in 2005, but we just hadn't made a lot of progress. And so when I came on board in the QA role, I remember our county manager come in and he invited me to his office, and he was like, "Hey, Jason, I'm getting ready to retire in 6 months. I want you to go ahead and meet all 9 program standards for me." And I was a little shocked because I had read through the standards enough to know that probably wasn't going to happen. And I was trying to think of how to let him down easily, but I just told him, I said, this isn't quite an easy thing to do. It's we'll do the best we can, but 6 months is probably not going to happen. But I do want to remind everyone that the program standards, they're a marathon. It's not a sprint. That you do have to set goals and you have to work toward them. And our goal was to try to do 1 standard per year. And we eventually met all 9. It did take us a little while to get there. We ended up doing a little more than 1 a year. But overall, if we didn't have that target, we wouldn't know where to aim, right? We wouldn't have the direction to go in. So when we started our journey, Chris Smith, you actually see him to the right of me in the brown jacket, our far right-hand side. He's got the kind of bluish jacket on, striped tie. Many of you may know him. He was my FDA retail specialist at the time. He kept pushing.
Okay, Amy, it seems like we're having some technical difficulty with Jason. So what we're going to do, can you hear me okay? All right, fantastic. Amy, can you please put up Mark Speltz's actual presentation? And Mark, we're going to turn it over to you, and I'm going to contact Jason, and we're going to get this fixed. So it gives me great pleasure to introduce Mark Speltz. Mark is going to talk to you from a regulatory perspective. And let's give Mark a big round of applause. All right, Mark, take it away.
All right, thank you, Tara, and thank you, AFDO, for the opportunity to kind of share some experiences that we've had here in Iowa using data systems to help us meet program standards. So I guess a little bit of background on us here as well is that we were early enrollees into the retail program standards back as early as 2002. And then, but really didn't, I didn't really engage with the standards, and we didn't do a ton with them until 2008 to 2010, and we started really digging into the standards. We had an opportunity in 2014 to build a new data system or adopt a new data system, and we took advantage of that system to help us actually dig into some of the things that made it easier for us to meet some of those program standards. So I really just wanted to share a couple of the experiences that we did and a few things that we did here in Iowa that you might be able to relate to, so you can make little changes. I just have wanted to share a couple of experiences that we've done here in Iowa with our data system to help us meet a couple of program standards. So I wanted to start with the standard 4, the Uniform Inspection Program. So we certainly found that in doing our quality assurance, our joint inspections, and our file reviews, that many of the things that we were doing back then, it was the 10 quality elements. Now it's 20 of those quality elements. We were able to do a lot of those things very easily. Our staff was well trained, and they were executing those things. But we found that there were a handful of those things that we weren't doing consistently, or at least as consistently as we wanted to. So what we tried to do when we were bringing on a new data system in 2014, and then a few times thereafter using some FDA grant dollars to make some enhancements, is we tried to create simple just-in-time guidance and also built-in reminders for our inspection staff. And that we were able to actually gain an overall inspection uniformity, improvement in inspection uniformity, as well as promoting risk-based inspection methods. So I wanted to talk about a couple of things that we did there. So within the system itself, our inspection staff have access to report marking instructions. So if they're on a particular question and they make an observation, but they're not exactly sure whether it's in or whether it's out of compliance, they can click a button and they can review that report marking instruction right there to help generate consistency. Another thing that we wanted to make sure that they had easy access to was inspection history. So we have plugged in some reminders, reminder questions, and also access to inspection history right from the inspection page where they're doing. So we've done reminders asking them to review inspection history, also asking if they've reviewed the menu. Also, during each inspection, they're asked to review the classification of the facility and also its risk assessment. So building those kind of reminders in, we started seeing more consistency with that as well. Just notification of when something's a repeat violation, as we know in standard 4, and also it's covered in standard 3, but in standard 4, we're required to treat repeat violations a little bit differently. So discuss and document long-term corrective actions. What we were finding is that sometimes our inspectors weren't identifying that it was a repeat violation when they reviewed the history. And even when they weren't always documenting their discussions that they had. So what we did is we built in some notifications and reminders during the inspection process as they're filling the form out. It will actually pop up and tell them, hey, this is a repeat violation. Have you documented your long-term discussions of corrective action? And giving those reminders to the inspectors within there, we've seen a huge increase in conformance in that particular element. We also did see inconsistencies in how inspectors were doing their validation or their verification inspections during HACCP and variances. So we actually built in a question set that was required responses for inspectors when the facility had a HACCP plan or that they had a variance. So those things helped us generate more consistency in that approach. The advantage of having those things built into the data system also saved us a lot of time. And these items certainly could be caught and we could train and we could educate our inspection staff when these things came about, but we would really have to be, as supervisors and managers, really reviewing lots and lots of inspection reports to kind of catch that, as opposed to catching it maybe while you're doing your quality assurance inspection. So we can see that it requires less effort on the parts of the supervisors and managers to actually reinforce these quality elements as well by building in these simple just-in-time reminders and guidance. Very similar for standard 6. When we were doing our standard 6 review early on, we were noticing that our procedure wasn't always being followed. So we tried to build in some automation and some compliance workflows into the data system as well. So we warn, so an inspector cites a violation out of compliance that's a risk factor, they're required to either mark it as corrected on site or to check it for follow-up, which creates some more automation. So no more risk factor violations being cited and then no scheduled follow-ups being conducted. They're automatically being scheduled. We had variations in our correct by date. Sometimes we would have something as little as a day to correct something, and sometimes we would have 90 days. So we automated those correct by dates to provide that consistency. We also automated the scheduling of the follow-up inspection. So it wasn't reliant on the inspector or a supervisor to review, to schedule that follow-up inspection. It was just automatically done at a particular time. We also created pre-populated templates for some of our compliance letters, and up to and including warning letters. So this increased the use of those tools as well. So, prior to that, again, it would have been a large supervisory initiative to issue compliance letters or warning letters. But now that we've automated it, our workflows are much more steady, and it requires less, again, oversight. And then we've developed some supervisor work lists within our data system as well. So those workflows kind of get put on people's lists. So an inspector is out, they're conducting an inspection, they believe that maybe a warning letter is due. They will select and request that warning letter during that inspection. And the next day or so, it populates on the supervisor's work list for them to take some workflow initiative. And the ball's now in their court. So automating that has really saved us a ton of time, not only from managers and supervisors, but also from our inspection staff. They really know what's next. They know if they kick that over to the next level, that will be picked up, and then they'll be notified down the road of where that request went. So it's built a little bit of trust in the system as well. And the biggest thing, it's created uniformity. We're seeing our procedures followed much more often than we were seeing them followed prior to establishing these workflows within the data system. So all of these are things that I think, as it relates to this training that we're having here today, and these are things that you could potentially look to do to increase uniformity and conformance with program standards while you're thinking about maybe making data system enhancements or building new data systems. So thank you for your time.
Mark, that was absolutely fantastic. Thank you so much. Does anybody have any questions for Mark? If you do, please put them in chat, because we want to make sure that you get your questions answered. Okay, let's see what we got going on in chat. All right, I don't see any questions at this time. Please feel free to put your questions in there if you do have it. And great news, we have Jason back with us. So Jason is going to be up to bat next. Oh, wait, here's a question for you, Mark. What is the name of the program used to automate the workflows? So what do you use, Mark?
So our inspection and licensing system is called USA Food Safety. I know it's used by a handful of other states at this point. So I know I'm trying to think of how many states are using the food side, but I think it's 12 or 13 different states that use that. So those workflows that we have are specific to Iowa, but the ability to utilize that technology the way that we had built it for other states is available. So there might be other states that I know there's some USA Food Safety user states here that are also in the audience, and they might be able to put into the chat too if they've picked up some of those workflows or they utilize them. But the system we use is USA Food Safety.
Fantastic. And again, Mark, thank you so much. That was spectacular. All right, now, Jason Reagan, take it away.
All right, let's try this one more time. I think I left off where I was talking about Chris Smith, my FDA retail specialist, helping us out with the grants. And so we had did a couple of those with the mentorship program, and then we actually moved into another one because as we met those standards, we realized that, hey, we've got to update our inspection software. There's areas that we really just can't change with the software company that we're with currently. So we applied for a grant to give us basically we went with Surface Pros, Windows Surface Pro units, and then we went with a new inspection software company. And so I'm not a grant writer, so I want to encourage any local health departments out there that, if you think, this is just stuff that's out of reach, it's not. The FDA, NACHO, NEHA, different ones, the grants that they put together for this stuff, in my opinion, they're pretty straightforward. And if you, like I said, even if you're not a grant writer, the answer is always no till you ask. So just, go ahead and apply, see if you can get the grants, because this stuff really will help you in the long run to meet the program standards. And so, and really the reason we needed to switch is we started seeing gaps in our standard 5. So there were some data fields that we needed captured. Our environmental epidemiologists, they needed some more information. And so basically with the new software, we were able to tweak that to add those things in there that we needed for the trackability of inspections. We needed to be able to pull some of our own data out so we could do some evaluations. It allowed us to be live in the field using our Surface Pros, and then our phones, we use them as hotspots. So we were able to do that. And so we had to basically work with the software company to create a system that we needed. And really that was adaptable as we move forward. So we didn't want to create the system and then we were locked in the same position we were in. And so as we worked with the software company and we progressed with the standards, even now, I'll reach out to them usually on a weekly basis. I'm like, hey, we might need to tweak this. This is something else that we may need. And so we worked through the process, and it's, it wasn't an easy transition, and switching databases, going from what we currently had to what we have now, getting staff on board, learning a new system. It's a growing process, but it was one that we had to go down because we felt like we had to in order to be able to meet the standards and to continue to grow and looking into the future. And so it's been a great process to make our food safety program better. We found gaps through the standards, and even with our own inspection software that, maybe you didn't know you had, but you kind of find them along the way. And it's like, oh yeah, we need to make sure we're addressing these issues. And so some of the biggest benefits for our department, I think the data system really makes our staff's jobs easier when they're in the field. Like I said, it captures data that's needed. So for our foodborne illness investigations, if we need to tweak something, we can, and that's a huge thing to be able to do that and customize that type of stuff. And so we can also see some of the stuff that the other presentation talked about is our inspection history. When they're in their current inspections, they can actually quickly see if the violation happened before, kind of a recap of what the wording was, what code violation it was, so we can see, do we need to mark it as a repeat or not? So that's one of the other benefits we had. We preloaded a lot of the food code violations in there. We preloaded a lot of notes that they could use. So when they're doing their inspections, they can pick the violation code, quickly kind of type what they did to fix it, if they could, and then they're able to quickly pick the code provision that talks about it. And it just makes their job that much easier to be able to go through the inspection. And it's live in the field. And so when they're done, when that inspection report, when they hit, finished, it basically goes live to the website. So people in the community have access to that. They know, I don't know about everybody else, but the news always loves to go on our website and keep cycling through. They're looking for the low scores, of course, but the data is there for anybody who wants to go out and eat with their family. They can pull it up and look at it. We get text alerts for complaints. So when a complaint comes in and it's assigned to the staff, they'll get a text alert and an email, which is really nice because there's some time constraints on, if it's a foodborne illness, we need to be out there within a certain amount of time. Depending on the other complaints, it's just different time frames. And so it's good for us to be able to get those when we're notified in the field, because we're not necessarily checking emails all the time, but usually we've got our phone on us if we hear that text alert. And so it just allows us, it's one more step that just makes it easier for us when we're doing these things. And the inspection software was good, but we've also utilized a cloud drive. So all of our stuff, we keep a master cloud drive. So all of our staff in the field can access forms, they can access past questions that we've had, like in our staff meetings on interpretations. I mean, anything we think of that they're going to need to either give to maybe to the restaurant owner, some handouts, some education material, all that stuff is.
All right, we must be getting crazy weather in Georgia today because his system went and froze on us again. No problem. So Amy, do me a favor, because obviously Jason has a lot of wealth of information that he's given us. Can you do me a favor and please pull up Paul's poll question, because we'll take it away to Paul. All right, so first we're going to do the poll question for Paul, and then Paul's going to, so here is the poll question: environmental health software. Which of the technologies describe your desired approach to environmental health software? Multiple choice. Database hosted in the cloud by the software vendor. Database hosted in-house by your own agency. Web-based inspections in the field requires connectivity. An offline mobile app in the field increases costs but works with. Okay. Here we go. Thank you. Polls are in. Polls are in. We're working on this. All right. Got a couple more people. Come on. We can do it. We can do it. You have 20 people out of 32. Let's go. Let's go. All right. Thank you. Wonderful. We've almost at 80% participation. That's fantastic. I'm going to end the poll now and then turn it over to Paul. Paul, what do you think of these results? Woo!
Oh, that looks good. Looks good. Can you hear me okay, Tara?
Perfectly. We have the all-time winner at 52% for offline mobile app in the field, followed by database hosted in-house by own agency at 44%. And then database hosted in the cloud by the software vendor at 36%. So I know you're going to educate us. So we are really excited for your presentation. So everyone give Paul a big round of applause.
Thank you. Thank you all very much.
All right.
Yeah, that poll makes sense because that last item that had the most attention was the ability to use the devices in the field when there's no connectivity. So that's pretty good when you're out in a rural area. Let's see, can you see my screen okay, Tara?
Yes, it's perfect. Perfect,
Okay, you can
perfect.
see. All right, okay. So, okay, thanks again, everybody, and thanks for the presentations that we already had. Those were great. So my name is Paul Smith with Inspect2Go, and I'm going to cover some of how the software can be used to help meet the standards. So just a few screenshots here and there and how they relate to the standards and make it a little bit easier to meet those standards for the FDA. So here's a little summary of my talk today. So government agencies face a lot of challenges when pursuing conformance with the standards because the standards require, robust record keeping and tracking and procedures that might be new. And my main point here is that the technology makes it easier, makes it a lot easier. And I'll show in this presentation examples of why technology can help in that pursuit. These are the 9 standards you're all familiar with. I'm going to talk about these first 4, and then Chirag is going to talk about the next 5. So I'll be talking a little bit, just briefly, about the regulatory foundation, training, inspection program based on HACCP, and a uniform inspection program. Okay, so you've all probably seen this form, I'm sure. So this is the different agencies have different food inspection forms for retail food. This is based on the FDA standards right here. And what I want to do is just talk about how the regulatory foundation applies and how software can be used to help access those codes and modify them and things like that. The regulatory code can be updated with, if you have a good software package, all the codes can be stored in the software, both on the cloud and also with the field device that you're using, whether it be a Surface Pro or an iPad or a laptop or something, so that you can access all those codes while you're in the field. And then you can manage them too on the back end of a good software package. So I'm just going to show you how this relates to just one little item here. So say we're doing a retail food establishment inspection, and we're down here on the section preventing contamination by hands. So this item number 8, hands are clean and properly washed. So in that, you can have the software have a section that relates to all the regulatory codes that are related to that item. And these go back to the FDA published documents. So it makes it a lot easier for the inspectors to have all of those regulations at their fingertips and have them organized in a way that's useful to them, because the items that apply to a certain line item here can be easily selected. So that's just one way that a good software package can help with regulatory foundation. Training, this is probably not one of the most important items of the presentation. I'd say it's maybe the least in that most agencies can track all this stuff by hand, but we do some tracking of staff requirements in the software. So things like the curriculum courses that have been taken, have they done their training inspections? Do they have the proper number of hours of training? And other staff metrics and performance indicators can be tracked as well. So standard 3, use an inspection program that's based on HACCP principles. So this is the standard here on the right, or at least the first screen of it. And so what I'm going to do is kind of show you how individual line items of this can apply to software. So like look at 1D. The standard requires that they have the selection of an in, out, NO, NA button, for example. So different line items in that inspection will require different buttons. So if you go back and you look at the standard on number 8, you'll see that the standard is to have an in button, an out button, don't have an NA button, do have a not observed button, things like that. So those come back over here, excuse me. And on that line item, the same line item as we discussed before, you'll have the proper buttons like in compliance, out of compliance, not observed, corrected on site, and repeat. Then also you can log your comments, you can take photos. We talked about accessing the regulatory code, things like that. So that's one way that, good software can help make this standard easier to meet. Here's another one here. Assign the inspection frequency based on risk categories. So in a good software package, you can come in here, you can assign different frequencies to different establishments based on their risk. And then that'll go here into the scheduler. So this helps a lot. You can have a scheduler that automatically schedules all the inspections for all the establishments. So you might have some that are on a more frequent, being inspected, say 3 times a year or 4, and one that's inspected once a year. And that can all be automated in the scheduler. And then you might even divide it up. So different inspectors have different establishments within their area, within their territory. And again, that's all automatic. They're rescheduled automatically. Your re-inspections are scheduled automatically. So software can help a lot with this. Here's another standard uniform inspection program. So a lot of arrows on this one, but basically I wanted to show you again how the standard relates to the software. So we'll just go through a few of these one by one. So looking at item 2, review the contents in the establishment file. So when you have a restaurant, say this Chili's here, you can go into the file and you can access all those documents related to that specific restaurant. So you can look at the HACCP plans and your establishment documents, everything that relates to that specific restaurant can be stored in that file for reference. Let's see, if you look at 3 and 6, verifies the establishment is in the proper risk category, uses risk-based inspection technology. So again, you can set all those up with each establishment. You can set its up how many inspections you want, its risk level, all that stuff. So looking at, let's see, number 7 here, accurately determines the compliance of each risk factor. So we talked a little bit about that earlier. And again, all those results are saved in the database. So you fill it all out in the field, check the right boxes, record the right violations, take your pictures and things. And it's all saved long-term. Then looking at number 5, applies the proper jurisdiction's laws and obtains corrective action, all these different things, and then going all the way down to your exit interview. So when you do an inspection, it's really nice to have, when you complete the inspection, it's really nice to have all these things at your fingertips. So with a good software package, you can have, whether it's a Surface Pro or a laptop or an iPad or whatever your field device is, at the end of the inspection, you can have, here we show just a little thumbnail of the inspection report. You can have all the regulatory codes that apply, or maybe just show the violations they had and the regulatory codes that apply to those violations. And then, you know, any violations, like in this case, there's a dog in the kitchen, all right? So they're in violation of having animals in the kitchen. So I don't know if you've ever seen that, but I thought it was kind of a cool picture. So those are all things that you could go over with the manager or a person in charge at the restaurant as you're doing your exit interview. And they can sign on the screen and they can see all the violations and the proof right there with the photo. So there's, you know, not much to argue about because you've got the evidence right there. And all that stuff is, not only is it signed by the by both the inspector and the manager on site, all that, the manager gets a copy either through an email or through the mail later. And also all this information is stored long-term in the database. So it can be stored for future reference. It can be stored for any citations. So that's just how software can be used to help meet standard 4. And
All right, Paul.
Oh, yes.
That is great. We did have a question out there, and they wanted to know if this recording is going to be available, and it will be available for you to use because they want their IT department to see the presentation and see what you're doing. So I know that with their IT department, you work with IT departments every day. Is that correct?
Right.
Okay. Okay, fantastic. All right, so let's talk about managing conformance. Go for it.
Okay, almost done here. So let's see. So managing conformance, just big picture, you know, any good software program is going to have sections on, you'll be able to manage permits and hopefully manage your finances and invoices and AR. And you can also do, we talked a little bit about scheduling, like all your inspections, schedule them by territory or by inspector and different frequencies, things like that. You'll want a good reporting system so that you can filter all this data by date ranges and other factors. And then trends. You'll want something that can run different reports and also hopefully make charts and graphs and help the supervisors and the directors really see what's going on and what's trending with their department. So let's see. So just in conclusion, a good software package makes conformance easier. This is done by having a workflow in the software that's kind of guided by the standards. So as you saw, where I'd start with the standard and show you some arrows going to what the software looks like, the standards can kind of be used as a blueprint for a good piece of software. You'll want the regulatory codes, ability to reference regulatory codes, follow HACCP principles, have a uniform inspection program, be able to take notes and photos and have the various buttons on there, have a good reporting system, good scheduling system, provide oversight to supervisors and directors, have a good QA and ability to review the results on the back end at the supervisor level, data storage. So all these inspection results and everything is stored long-term, and go hopefully completely paperless, which is what some of our clients are doing. So that's it. So again, my name is Paul Smith. I'm with Inspect2Go, and thank you all for taking the time to listen to the presentation.
Oh, that was fantastic. Excellent. Okay, any questions out there in the world? Let's have them now for Paul. If not, you can put them in chat and we'll catch them at the end. But Paul, thank you so much for presenting here at AFCO. We greatly appreciate it. That was spectacular.
Thanks for the invitation.
Yes. Amy, could you please pull up Chirag's poll? Thank you so much. What is the biggest factor when agencies do not want to use technology? Funding, staff hesitation, authority approval, don't like technology. All right, let's see what we got here. Dun, 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 dun. All right, good participation. Keep going, keep going. Okay, the poll's going to close in about 2 seconds. Get your final answer in. All right, here we go. End poll. So funding is that 74% of everyone said funding, followed by authority approval, followed by staff hesitancy. Okay, now it's time for your presentation, Chirag. And we are so excited. So if Paul, you could take your presentation down, that would be fantastic, and allow Chirag to go ahead and share his. All right. Let's give Chirag a big round of applause. Yay, Chirag. Chirag, can you hear us?
Yes, yes.
Okay, fantastic. Thank
Can
you
you hear
very
me
much for
okay?
presenting today. We're super excited to hear your presentation. Take it away.
Thanks, Tara, and thanks for the invitation. And it's good to see some of the familiar names in the chat messages. And today, my role here is to not sell you anything, or not to be a computer programmer, or not a software developer, but merely a fact that there's so much funding available. There's so much grants that FDA is allocating in order for the local, state, and the city, county, public health district agencies to apply for these grants, so that we can have program standards compliance throughout the country as much as we can. And a little bit about myself, I've been one of you. I have spent over 25 years with the local health department here in Houston in my past life. And currently I work with the company called HealthSpace USA as their regulatory affairs for the environmental health division special. So my role is to facilitate and help the technical team, at the same time the local regulatory folks. So today, what I'm going to be doing is basically sharing what the standards are according to the program standards that are established. Standard 5 talks about foodborne illness and the food defense preparedness and response. So here are some of the basic requirement summary. The data management program or the software solution must be able to detect, collect, investigate, and respond to the FBI and the food defense and preparedness responses. There are complaints, there are emergencies, there are injuries, there are intentional and unintentional food contamination that each and every one of you deal with on a daily basis. Standard 6 talks about compliance and enforcement. And throughout our presentation today, you've heard Jason and Mark and Paul talk about some of these standards. This particular standard about compliance and enforcement is a very key component of being in compliance with your program standards. Repeat violation, notice of violation, court citation. Some agencies issue a municipal court citations to the operator when the item or the violation has been repeated multiple times. Some agencies will shut them down depending on the risk factor and the severity of the particular infraction. And follow-up actions. As we know, there's a re-inspections, there is a suspension hearing, there's a revocation hearing, and there is a very critical part of it, a timely correction of the violation. And the inspectors that are out in the field, they have to know. They have to know that this particular item has been noted on their inspection report in the past, and therefore it's time for them to show some active managerial control and some corrective action plan so that prevention of foodborne illnesses happens at a true level. Industry and community relationship. This is probably one of the most easy to comply with standard because most of the agencies nowadays will have some kind of participation within their community and the industry that they regulate. You have forums that foster communication and exchange the information with the industry and the consumer groups. There are outreach activities. You have a very nice website. You have a very nice social media account where you share the information that are relevant and current as far as the public health is concerned. And especially in case of food and food safety, you'll probably have a bigger role. Standard 8 talks about show me the money, right? Is your program supported? Do you have adequate resources? Is there adequate funding? And I think Tara, during the break, asked this poll question. What is the biggest concern or biggest hurdle in order for you as an agency to implement software solution in your day-to-day life? Funding. You have to find a way to be creative and get some funding so that you can do this. And many times people in the industry and in the regulatory world, they think that having a software solution is very expensive. When you really think about it, it's not, because it is definitely going to make your day and your lives much easier. Do you have adequate staff? Do you have proper equipment? You have proper tools for you to do your compliance with the program standards? And I think Jason and Mark can probably vouch for this. Standard 9, the program assessment component, may be the most challenging and the most hard to achieve standard within all the 9 standards. You have to do your risk factor study on the occurrence of the 5 foodborne illness risk factors that FDA has defined. And this particular study has to be done every 5 years at a minimum to measure the trends in the regulated area that you regulate. The data that you collect must be analyzed because everyone will have data. What you do with the data is the key part. Report on the outcomes. The risk factor study must be done. And targeted intervention strategies have to be designed. So if you identify that within this particular category of the establishments that you regulate, if the hand washing related violation seems to be the number one marked violation, what are you going to do? How are you going to educate? How are you going to provide the information to that section of the regulated component? What to do so that next time when you do your study, hopefully the hand washing related items and the violations are reduced to a greater extent. And the effectiveness of the strategy has to be evaluated. So if you did that study, if you added some strategies so that you have educated that particular segment, then next time when you do your study, did it improve it? And if not, then you're probably going to have to restart the process and come up with a different strategy. So standard 9 is the biggest component in the program standards. So those are the standards 4 through 9 that I wanted to talk to you all about, and saying that how important those are. So let's talk about the grants that's available. And I think most of you have probably seen numerous presentations where they talk about the tracks and the grant funding that's available. So just briefly, track 1, there is 3 different types that you can get quite a bit of funding: development-based grant, mentorship grant. And mentorship is probably the easiest thing that you can sign up for. And the optional training and the staff development grant can also allow you to train your regulatory inspectors or investigators. In track 2, as you can see on the screen, you have base grant and mentorship grant, and again, the training and the staff development grant. In addition, in track 2, you can apply for the IFSS add-on. You can apply for a capacity building grant. Now, this number is fairly large number. You're talking about $100,000 per year for 3 years. So the optional capacity building grant is the collaborative project which allows you to leverage the strength, knowledge, tools, and other resources in your geographical area. So you can team up with, you can partner up with some of the surrounding counties or cities where you are and come up with a grant application that can allow you to even acquire a software solution, because the capacity building grant is a component of the grant that allows an agency to go out and tap in to that capacity building grant, because it's a little costly grant fund that FDA is handing out. Track 3, this is for maintenance and advancement. And I'm not going to talk about who's eligible and who's not and what all you have to do. You have a lot of resources. AFTO provides all the resources. NEHA, who's become an entity that's helping the FDA to allocate the grant, they also have many resources available on their website that can allow you to ascertain whether you as your agency are eligible for this track or that track, and whether you can apply for this add-on grant or not. But in track 3, you have public health matrix funding, repeat self-assessment, continuous improvement, but conformance, maintenance, mentorship, training, of course, the capacity building, and the special projects that add on up to $20,000 for the IFSS. So Paul mentioned to you during his presentation that you must find a software solution that allows you to go through this process and procedure in a much easier way. Yes, everybody probably knows how to use an Excel data spreadsheet, right? But there's only limited number of things that you can do with Excel. One of the questions that was asked during our poll question was an in-house design system. Many local regulatory agencies have a robust IT team that has designed their own software solution. It's limited. And my biggest con to that concept is what happens when that IT person or persons or the team somehow is eliminated because your local regulatory agency is going through some funding issues and the team is dissolved and you don't have anyone to support it. So you have to look at all the other categories in addition to the funding that it may take for you to have a software solution. What is the best solution for you? What is the best as far as the bang for your buck for you? And many times people shy away from asking a software solution provider company to design the software for you, but you'll be surprised to find out if you really get into it and find out it's not really that difficult. And that's all I have as far as sharing some information with you as far as the standards are concerned. Here's my contact information, and I'll be happy to answer questions that you may have based on the presentation, whether it's for me or for Paul or Mark or Jason. And as Jason started the conversation, I live here in Houston, and go Astros.
There you go. Well, Sharad, thank you so much. That was spectacular. Thank you. Round of applause for Sharad. All right. Now, you've heard from 4 of our speakers. We're all so happy that you took the time to actually do this. I'm going to open it up for questions and make sure that you have what you need in order to be successful, because that deadline is approaching. The deadline is November 15th. November 15th, the time is now. We have resources here that can help. So what do you need from us and how can we help you? It certainly is a quiet group. All right, well, do we have any closing thoughts? So Mark and Paul, could you please come online? If you don't mind, let's see your smiling faces, Mark and Paul. So since we have no more questions, I'm going to take it, throw it around to all of you and give some closing thoughts, starting with Mark, going to Paul, and then Sharad. You can end this up for today. All right, Mark, take it away.
Sure. So just wanted to let everybody know that if technology can be intimidating, especially from the business side. I'm not a computer person. But I think just talking through what some simple technology solutions can be for the business problem that you're encountering with a professional can help you identify whether it's a workflow issue or something else related to standards conformance. It really can have a huge benefit, very simple things that get added to the system, or if you're in the process of, building a new system or something, definitely the technology folks can help you understand it. So don't fear it. And I think look for opportunities to make small changes. Those things can also be worked into grant applications as well. It doesn't have to be, hundreds of $1,000s for an entirely new system. It could be, hey, we're going to build this workflow, or hey, we're going to add this component to the system that we currently have, and that will help us achieve conformance with standard. I think those things too are sometimes overlooked in grant funding because maybe they seem too small. So anyway, I just encourage you to talk to whoever your vendor is or talk to whoever your IT folks are and explore what types of solutions you could have within the system you do have to help you conform to standards in an easier way.
Awesome. Thank you, Mark. Thank you so much. Really appreciate seeing you. It's so nice that you're here and supporting us. Thank you. All right, Paul, closing thoughts, please.
Well, to follow up on what Mark said about doing something small. When I look at different projects out there, that's one thing that people do. You don't need to try to meet like all 9 standards and do this huge system and this huge effort. People chip away at it. So do, 1 or 2 standards one year, or 1 standard one year, just 1. And so it's an easier way to kind of take this big project and reduce it to something manageable. And then the next year do another standard maybe, and that kind of thing. And that ties in well with the grant funding too. That I think the FDA, I've seen them fund projects like that where we're addressing a piece of the overall plan. And I think technology, the other thing I want to stress is, one thing I started out with the presentation was that technology makes it easier. It makes it easier to meet those standards. And I think it makes it easier it's a good way to apply the funding to help agencies meet their goals.
Excellent, excellent. Thank you, Paul, very much. Thank you for joining us. Thank you for being a part of our team. Really appreciate it. All right, Shirag, take it away.
Thank you, Tara and AFTO for coordinating this. And I think hopefully people that are participating are getting some information that we've heard. Mark mentioned it, that technology could be intimidating. Jason mentioned something, that meeting all the standard is not a marathon. It's not a sprint, it's a marathon, right? You have to take step at a time. So I probably want to use a baseball analogy, right? That you can't win a game in the first inning. You got to play 9 innings. So similarly, you have 9 standards here, and you're going to have to take a little bit here and there. And it's okay if you don't meet all 9 standards right away. Kudos to Jason and his team for being one of the very few agencies currently in our country that meets all 9 standards. Speaking of intimidation, I shared with you that I used to be one of the regulatory person. And back in 2005, in Houston Health Department, we implemented technology. The pushback, the resistance, the hesitancy from some of the old timers, folks that have been there for some time, was huge. A couple of them actually threatened that if you do this, I'm actually going to go retire. But, it was time for agencies to start being on the technology highway. So what technology was in 2005 versus what it is now, it's very different. And I remember back in 2005 and 6, anytime you had to change something, Mark mentioned something, that something happens and you tweak. Jason mentioned it, that you have a software solution and things change all the time. The code changes, the procedures may change, the risk factor categorization may change based on your local perspective, etc. But when it changes, you don't need to be reaching out to the programmer and say, I need to fix this. You should be, with this new technology that's available in the market now, you should be, as a super user, be able to log into your system and change that frequency from 30 to 45 days, or the other way around, from 45 days to 30, if so needed. So technology has really evolved over the years, and agencies that are skeptical in using technology, because they are applying for this program standard grants, they shouldn't be. There are resources that are available out there, and there are people that can certainly help and facilitate your agencies to get on that program standards level. Thank you all, and thanks for having me again.
Excellent. Thank you, Shirag. Wonderful. All right, this concludes our program for today. I see no questions. Thank you all. Stay tuned to next month when we talk more about technology, more about this so that you can achieve the goals that you want, but get on and apply. November 15th is the deadline. Let's make that happen. All right, everyone, be safe, be well. Thank you on behalf of AFTO. And Amy, thank you so much. Take care, y'all.